Erin Andrews spreads awareness about cervical cancer, what you should know. Good Morning America, March 13, 2018. In 2018, more than 13,000 women could be diagnosed with invasive cervical cancer and more than 4,000 women could die from it, according to estimates from the American Cancer Society, and it is often preventable with a regular screening. In 2016, Dancing with the Stars co-host Erin Andrews was one of the thousands of women diagnosed with cervical cancer. Photo: Dancing with the Stars host Erin Andrews speaks at on Good Morning America, March 13, 2018, about her battle with cervical cancer. ABC News. More. Erin Andrews shares wedding photos. Dancing with the Stars host Erin Andrews weds Jarrett Stoll. I think what went through my mind is what everyone thinks of, I'm sorry. I have what? Andrews, 39, said in an interview that aired today on Good Morning America. My doctor told me what was going on and my first reaction was like, how bad is this? Andrews, also a sports reporter, had surgery a few weeks after her diagnosis. Just 3 days post-surgery she traveled to cover a Green Bay Packers vs Dallas Cowboys NFL game. That's where I feel better, is on the sidelines, Andrews explained. I could actually forget about it. It is where I felt like this is me. Photo: Sports reporter Erin Andrews talks to Everson Griffin of the Minnesota Vikings after an NFL game at Ford Field in Detroit on November 23, 2016. Dave Reginek, Getty Images. More. She is now helping to raise awareness of screening and treatments for cervical cancer. Everybody said this: there is nothing is wrong with you. You are healthy. You go work out all of the time. There are no symptoms, Andrews recalled. And that's what makes this something that should urge you to go to the doctor more. Photo: co-hosts Tom Bergeron and Erin Andrews of Dancing with the Stars. Eric McCandless, ABC. More. Now cancer-free, Andrews is hoping to start a family with her husband, former NHL player Jarrett Stoll. I didn't have to have a hysterectomy and so I'm fully capable of having a baby, Andrews said. But that is because I went and got tested and because we were able to treat it early, and that is all you need to tell the women in your life. Here is what women should know about cervical cancer. What is cervical cancer? It starts on the lower part of uterus when normal cells change, or mutate, and then grows into a large mass, or tumor. If not treated, it can spread out of control to lymph nodes, or other organs like the lungs, liver or brain. It tends to occur in women between the ages of 35 and 44. How does cervical cancer develop? How does a cell change from a normal cervix cell to cancer? It's a gradual process, with many stages, including what doctors may call atypical cells and interepithelial lesions. A major cause of all of these changes is the human papillomavirus. HPV can attack the cervix and target the cell's genes, causing mutations. Other risk factors may be preventable, including smoking and a history of sexually transmitted diseases. What are the symptoms? Sometimes there are few noticeable symptoms. Women might notice bleeding or pain after intercourse or unusual discharge from the vagina, symptoms which can arise because of the tumor. How is cervical cancer diagnosed? When doctors think cervical cancer is possible, biopsies can be performed to analyze the cells. They can take scrapings or cut a sample of the area or suspicious mass, which lets them diagnose cervical cancer with certainty. Since other diseases can cause symptoms similar to those in cervical cancer, general doctors and gynecologists will often perform pelvic exams and can do additional tests, like the familiar Pap smear, to find small or hidden cancers and catch them early. The Pap smear uses a small brush to scrape cells off the cervix, which can be checked under a microscope for cancer.